Letrozole or tamoxifen in an IVF cycle. What does better? Now, this was an interesting paper which looked at the number of oocytes obtained during oocyte banking, embryo banking, and they analyzed 42,854 fresh banking cycles in the SART cohort from the United States. And what did they find out? They found out that oocyte yield of those using letrozole had fewer number of oocytes compared to that of tamoxifen. And that is something very interesting. Why is it interesting? It's interesting mainly because in PCOS, using letrozole does help even in IVF, and the number of oocytes were 12.1 versus 14.4. There was no difference seen and found in oocyte yield between tamoxifen and no additional cycles. In gonadotrophic treatments, especially in cancer patients, they did not see that letrozole does not seem to affect oocyte yield. So when using it for cancer, you did not seem to see a general decline. The rates were similar whether you use letrozole or tamoxifen. But if you were to use tamoxifen, the advantage is that you required a lower amount of FSH. Why? Because tamoxifen significantly increases FSH secretion and thus would be saving costs. So what are the clinical implications? Now, if you were to use letrozole in cancer cases, it seems to be beneficial because it keeps the estrogen levels lower. Though in normal responders, using letrozole in IVF reduces the number of oocytes. Tamoxifen does something different. It does not negatively impact oocytes and may in fact reduce the amount of FSH you use. The advantage again of using letrozole in PCOS is that it keeps the estrogen levels low, makes this the treatment better, and may in those cases, from one study, slightly increase the number of oocytes.